Hi, my name is Dr. Siegfried, and thanks a lot for coming to my video YouTube session on desktop wellness, where we're going to be talking about things you can do at your desk while sitting. The question is, who is this video for? Well, it's for what we would call desk jockeys, standing desk jockeys, walking desk jockeys who have treadmills at their desk, also people with challenging neck, upper, and lower back pain. You see, the problem is that we all have very sedentary, not we all, but a lot of people have sedentary jobs today. So the question would be, do you sit at a desk most of the day? Are you standing? Short of working as a field laborer, construction person, or any other number of jobs where you are on your feet and moving all day long, your job is pretty much considered sedentary. And as such, you are unfortunately not using your body and muscles the way they were designed to be used, and that is by moving. So there seems to be more and more desk jobs occurring daily. And what with all the high-tech advances occurring all the time, more and more time is spent in front of a computer, for one, but also on the phone. Yes, people in companies still are using phones. Driving and sitting, as a matter of fact, they're using their phones. So common breaks that sedentary people take might be to take a walk, stretch, go outside, anything to break up the time being sedentary at their desk. We can't always change jobs much as we would like to, which is a whole other topic. However, we can minimize the stress on our backs and necks, and ultimately our nervous system, by doing a few simple exercises or stretches throughout the day. In my 30 years of practice, I've come up with a few simple, easy, rejuvenating exercises or stretches, which are now part of my functional wellness program called Desktop Wellness, exercise while sitting. They're easy, they're quick, they're relaxing, and they're rejuvenating at the same time. In fact, you might even notice you don't have to go take a coffee break because it charges up your spine, your nervous system. So here they are. And this is the solution to the desktop wellness problem, which is some of these things I'm going to show you. But to begin with, it's very helpful to understand why these are so beneficial and important to your body. Now, in the Western world, we sit a lot, and this predisposes us to all kinds of neck and back ailments. Why? Because when we sit in a chair, pretty much any chair, we're in what is called ligamentous posture, which means we're not really using our muscles. We're literally being propped up by the chair we are sitting in. As you can see here, I'm not using any muscles, I'm just being propped up. So as a result, we're kind of like a sack of potatoes. So you're propped up, and you can, unfortunately, a lot of times you'll lean to one side where the position is more comfortable. You'll be on a phone like this, which is more comfortable. You'll be leaning forward like this, which is more comfortable. You're not using any kind of muscles. You're not using any muscles at all. It's kind of like sitting on a soft chaired sofa, which is really comfortable, but there's no real support. So you're just like a sack of potatoes. And what that's doing, the significance of this position that I'm sitting in like this, that we find ourselves in an awful lot, the significance of this sack of potatoes position is that our spinal ligaments that are designed to hold bones in proper position, they stretch, they weaken, and this allows the bones to get out of place, putting pressure on your spinal nerves, causing headaches, neck pain, back pain, arm pain, leg pain, carpal tunnel syndrome, sciatica pain, etc. So again, remember the sack of potatoes position is not good for us. You're in ligamentous posture. It allows the ligaments in your spine to stretch, the bones get out of place, put pressure on the nerves, and you have these conditions. But there's good news, and there's something you can do about it very simply as you sit in your desk so that you can keep these spinal ligaments from stretching throughout the day, because your muscles will be fired up a little bit. So let's get started on your 5-minute desktop wellness program. Okay, you're sitting at your desk in front of your computer like this. So what I want you to do is push your chair back like this and sit up straight. And I want you to follow this 5-minute program. You roll your head gently and slowly to the left, just like this. This is activating all kinds of neurons in your brain and spinal column. And then you go to the right 5 or 10 times, very, very slowly. And then you move your head forward and backwards like this, 5 to 10 times. Another way to describe it is to just look down as if you wanted to touch your chin to your chest like that, and then look back. But you're not to strain, you're just to put some movement in there. And then you move your head, you can turn your head after that one, after you move your head down and back, you turn your head to the left and to the right, very gently. You might notice you can go further to one side than the other. That means your spine's locked up, needs to be adjusted, but that's another issue. We'll deal with that later. You can still do some gentle exercise, which is only going to loosen things up as best you possibly can at this point in your little exercise program. The next thing you can do is lace your hands behind your neck, like this. And your elbows are out to the side. And you look up at the ceiling. Your shoulders are back. Your chest is out, and you pull your stomach in, and you start to swivel, like this. Or rotate. And you just swivel or rotate like this. In this position, you would look like this. And what that's doing, it's a great stretch. It's a great way to activate a lot of the muscles and the tendons, which relieves a lot of the stress from leaning forward or to the side all the time. You will feel this in your back, your shoulders, your elbows, your belly, your chest, even in your hips, depending on how tight your chair is. So you can do that 5 to 10 times. It's a great stretch, which relieves a lot of the stress at your desk. Then what you can do is relax and try to put your arms behind you, holding the palms of your hands together like this. And you do this very, very gently. None of these exercises or stretches are designed to go anywhere past just some resistances for you, which is normal for you. So you do this gently. Once you get your hands together, try and extend your arms backwards like this, or you try to straighten them out as best you can. Now sometimes people can only go like, sometimes people are lucky to just get their hands together, but your hands should be like this. And that's okay because you're not used to the stretch. You could be tight because of shoulder, elbow, back, whatever. So you put your hands like this and you do a count. You do this position count for 5 to 10 seconds. Let's say you can only go like this. You hold it for 5 to 10 seconds and then you relax. You hold it and then you relax. You hold it and then you relax. And you can do this 5, 10, 15 times if you'd like. And you just go to your tolerance. You do not strain. If you do some of these things regularly, you will notice that your flexibility will be increasing. You'll feel charged up at your desk. You're not going to break a sweat or anything because it's really not that much activity, but you will feel charged up. Might keep you from having a couple coffee breaks, but that's the idea, is to loosen these things up. Now, a little more aggressive stretch for those who have the option of being able to get on the floor without so much trouble is this one. And this can be done on the floor, in an office cubicle, even a walkway. It depends, because I have patients, and depending on who you are, you may be in this situation where you can get on the floor like this. So what you do is you sit on the floor, and you notice I have my legs out. And I'm not talking about rubber band stretching like a dancer. Just simply put your feet on the floor to where they're most comfortable. And this can actually get you nice and relaxed. And then what you do is you put your feet like this, and then you do this. We call this rock and roll, like this. We call this, let me see here, move this here a little bit. We call this one rock and roll, just like this, rock and roll. And what that does, it's kind of like it's actually a type of a spinal adjustment. You may feel some clicking and popping in your lower or upper back as well. And patients who can do this love it. Might take a little getting used to, but be patient, and I guarantee you it will be one of your favorites because it provides such a good stretch and a lot of relief for back pain that you can get while you're at your desk, mid back pain that you might get while you're at your desk. So now I'm going to show you some seated lower body exercises. With you sitting at your chair, you put your legs out like this, and you bring them back. And you do this 5 to 10 times. Put your hands on your seat, and you go back and forth 5 to 10 times. You can do that as much as you want, in fact. Then you can go like this if you want. You can go like this if you want. And then you can come up and down like this if you want. You can do 5 or 10 sets of 5 or 10 of those as much as you like. And you just go to do a number count, and then quit when you're ready. Now the other thing is, after you're done with these exercises, you want to be sure and make sure you're properly hydrated. In fact, you should be hydrated before as well. And the kind of water that I suggest that patients drink is Earth 2O, which is spring water, to refresh your nervous system and your muscles. And remember this, anytime you want to charge up your system naturally, you can just drink a pint bottle of Earth 2O spring water. The reason that I suggest Earth 2O spring water is because it comes from Opal Springs in Central Oregon. And it comes from 850 feet in the ground in a very deep aquifer. And the only thing that's done to it, they take it out of the ground and put it into a bottle, a plastic bottle that's inert. It's 1A plastic. It's fantastic water, and it's probably one of the best commercial waters I could suggest to you. You should be drinking several of those a day. So these simple yet dynamic exercises will help you during your day at work. And I recommend them. A lot of times it's mid-morning and mid-afternoon when you start to go into tank in terms of your energy level. So if you try drinking some water, doing a few of these exercises, you will notice that your energy will increase, your focus at your desk will increase, you'll just feel overall better. Now if you have any questions about this, any of the things that I've shown you today, I want you to feel free to call me at my office. I want you to remember something. Most people don't know this, but maybe you do. Chiropractic adjustments are very important because they help to keep your bones from pressing on your nerves. And whether or not you've been adjusted lately, you might consider it if you have this chronic back or neck pain you can't get rid of with some exercise. And the reason why, for example, if you do exercise and it doesn't help with something like this, like these exercises I showed you, it's because there's pressure on the nerves. The bones are pinching the nerves. And that means that the nerves are pinched, your muscles go into spasm, your movement goes down, it hurts to move, which makes it worse. And this is why a lot of people will take anti-inflammatories of ibuprofen, Aleve, Tylenol, all of those things, which might cut the pain for a little bit, but it doesn't really change what's going on. It's just you're alleviating the pain maybe for a little bit, in addition to which your side effects of the stomach, liver, kidneys, etc. That's a whole other discussion. But the point is, when the nerve is pinched, the muscles will go into spasm and the movement doesn't occur, and you can try to move it all day long, stretch, whatever. But until that pressure gets off the nerve, you got problems. So the point is, this is why you might want to come see me. If the things that I show you don't help, or if you have other questions about what I have to offer, you should come see me. We can discuss all this. And in doing so, we can find out why things aren't working as well as you'd like them to be, and put you on some kind of a program that gets you on a path to wellness. It's a process, but it's something that, in my experience, when patients are serious, I can empower them. I can empower you to take care of yourself at home, make less use of me, and on you go, living your life the way you want to, which is what it's all about. So you can contact me in McMinnville at 503-472-6550, or at my Portland office at 503-977-0055, or you could go to my website, which explains some more of these services. But I have to tell you, my website is a work in progress. But in any case, my website is www.oregonwellnesscare.com. I'd like to thank you for listening and watching today, and I look forward to sharing more information more of my clinical information and experience with you, and I'll see you on the next video.